First of all, I want to commiserate with the families involved in the Carter family and the loss of that lovely child. It's so sad. And because so many people do so much good work, doctors, nurses, in our health service, it has to be acknowledged that they do. And it's sad to see that trust is being broken in a case like this. We see the same with CAMS. And what I want to ask you, Minister, the chain of command, who's responsible for what? I mean, this is a scandal. And I mean, is anyone going to be held culpable? But there's someone in charge of the surgeon? Well, the surgeon, we don't know. What's your responsibility? You're the Minister for Health. Should you be overseeing what has gone on here, or know more about it a lot sooner?
Thanks, Deputy. Look, it's a very fair question. The answer to that is there are extensive patient safety and clinical governance mechanisms in place in all of our hospitals to do at every procedure. In this case, there were 2 serious incident reviews kicked off. They will be reporting very shortly. They've done extensive work on what happened in 2 particular cases. Concerns were raised through the multidisciplinary team. That kicked off an internal and an external review. A complaint has been made to the Medical Council. The Medical Council is now carrying out its own work. Neither the Chief Clinical Officer nor I were satisfied that the internal and the external reviews sufficiently answered the questions. I agree with an awful lot of what was said this evening in terms of it not identifying what went wrong. Those 2 reports are useful in terms of making sure that everything that should be happening is happening, but I think, as Deputy Shortall alluded to, they don't call out what went wrong. So Dr. Colm Henry and I were not satisfied that the questions had been answered to the level they needed to be answered, and that's why this additional review is being carried out.
So this review was triggered by complaints from clinicians and staff about the problems with infections and complications following surgeries. Last October, I mean, that's almost 12 months ago, and it is frightening to think that so many children were affected, 16 or 19, I'm not sure now, but one has died, one too many, and it's very serious. I mean, it has to be narrowed down as to who was responsible. I mean, the HSE are getting an awful lot of money, and they need an awful lot of money, but we need to ensure that something like this never again happens, Minister. I mean, we're told not to put spurious parts in certain vehicles, and that's been crude about it. But this is what's happened here. And who ordered what? And who discretion was this to decide to purchase these?
Thanks, Deputy. That's exactly what 2 reviews are looking at. An external review commissioned by CHI and the external review commissioned by the Chief Clinical Officer, with the reviewer reporting into the Chief Clinical Officer and regular meetings with myself as well. This is exactly what we need to establish.
Thank you, Minister.